Um, Congressman Trone, we are so excited that you're able to join us today for Addiction Policy Forum's National Leadership Conference. This is our fourth conference, which is very exciting. And since we're still a little bit apart and not in person this year, this afternoon has been a bit of our virtual Hill Day. And we are actually highlighting two of your pieces of legislation that you've sponsored as our top 8 priorities for this Congress. And for all of our attendees and network that are joining us, Congressman Trone has really emerged as a champion in addressing addiction and the opioid crisis in Congress. He's from my home state here in Maryland, and actually I'm a constituent, so I'm in your district here in Rockville. And your passion, you show up to our local events and our national events. You are leading such critical legislation that really spans a lot of the focus areas that we as a network, and a little bit about APF, we have the whole continuum represented. We have patients and families, we have grassroots leaders, we have physicians, researchers. This is really about making sure everyone is welcome at the table to advance improvements in how we respond to addiction. I'm an impacted family member, and a lot of our staff at APF has been affected personally by the disease of addiction. And our network is just so amazing and committed and really excited about working in partnership with you to make sure that your family support services bill and your Stop Stigma bill get signed into law. And we can be quite a persistent and focused crew. And so we're very grateful to you for all that you do, Congressman Trone. And we'll hush up now so we can hear from you about all of the work that you're doing in Congress.
Okay, great. And you want to talk about 5 or 10 minutes and then answer some questions? Is that the format you'd like?
Yes, that would be fantastic. We gave you 15 minutes to chat about all of your priorities, anything you do. And if you have time for some Q&A, that would be lovely.
Right, we're good for some Q&A until they call votes. We've been working on addiction all day today. Just got off the phone with Director Gupta. We had a long conversation about, he just was confirmed on the 28th to lead ONDCP. So I recommended him to the White House. So we're delighted he was confirmed. And we had a really good chat about direction and things we want to get accomplished, especially starting in the first quarter of next year, as we put Build Back Better, the infrastructure bill, COVID for children, second shots, and the business rollout, which will drive COVID vax rates way up in the rearview mirror. It's that time we're looking to get the Biden administration focused in Q1 early on addiction and mental health, the two biggest losers that have come out of the COVID pandemic. So I know I'm talking to the audience here, but that is, the converted, but that is our plan. And we talked to the president directly about that. I talked to his chief of staff 2 weeks ago, and we've talked to Mr. Ricchetti and Senator Richmond and others to try and move this ball forward. And we're working with ONDCP in cooperation to make this happen. So we really appreciate the other folks you've had on earlier. Senator Capito has been a great leader. Really enjoyed that work. And Fitzpatrick is, a home run. I just love working with Brian Fitzpatrick. And we serve together on all kinds of stuff we do together. So kudos, you got some real winners there. And Representative Jackson Lee's always been very helpful. So thanks to Addiction Policy Forum. Your partnership has been really great. My team loves working with you. We're looking for ideas. We're looking for guidance and things that we can go to work on. We love policy. I love getting Republican votes, Republicans on my bills. And then when I get to Republicans, I can easily add all the Democrats all day long. So my mission is take the bills clean, go get Republicans co-sponsors. Once I build them up, then go over, I'll load on the Democrats, then we can roll through and try and use those Republicans in the House to help me build my connectivity on the real target, which is Republican Senate. That's my real target at the end of the day, when I work to figure out how to get to 60. So that's the battle, but you having ideas and contact points and suggestions is really helpful, and we appreciate it. We like to first, as you know, this is personal to me. You know, my dad was an alcoholic. It led to the bankruptcy of our farm and started me in business on my own. And I lost my nephew to addiction to fentanyl at age 24. And I spent a lot of time with him in halfway houses, 5 arrests, mental health challenges, job problems, housing problems, you know, the whole gamut of issues that the family support bill helps, you know, was formed from. That 5 years of experience, my wife and I were in the trenches dealing weekly with these issues on how to get a job, how to get the right halfway house, working on anxiety, depression, and you know, a lot of charges, criminal impact. So we realize this is personal. It's the #1 thing I do in my office is addiction, and right behind that is mental health, obviously the co-occurrence, and with that is also criminal justice. I've led the ACLU in criminal justice in this area for probably 2 decades. My foundation set up the Trone Center in New York City that does all the ACLU work on justice and equality. So it's called the Trone Center for Justice and Equality. All the CJR work comes out of that. So we're very involved in criminal justice, especially how it impacts addiction. So those are our missions. The stigma, we're going to talk about first, the Stop Stigma Act. You know, I got Republican Lisa McLean. She's a business person. She's new. I'm trying to get new people involved. They bring new contacts, and they've got more time in their day. And if I can begin to fill their day up with stuff on addiction and mental health, they'll become long-term partners for me versus just going to the same old, same old. So I'm trying to spread out my my team on the Republican side. So Lisa, common sense business owner, and was very happy to sign on this bill. It's over at E&C now. And all we're trying to do is a simple thing, change the government agencies that talk about abuse, 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 and try and get that type of stigmatizing language out of NIDA, out of SAMHSA, et cetera. Straightforward, simple. We ought to be able to get it done. And it's also endorsed, of course, by the Bipartisan Addiction and Mental Health Task Force. So I took my freshman group, which I had, you know, 80 some members, and I combined it with Andy Custer's group and Fitzpatrick. I put the whole thing together. I expanded it to add mental health to it. So I wanted to get that part of our charter. We bumped the numbers up to 140. And so we have the biggest group that's out there now on addiction and mental health. And, you know, it's bipartisan with Herrera Butler also. So we've got a good team, myself, Andy, and, you know, Brian Herrera Butler. So, you know, we got 70 bills coming out of that task force on addiction, mental health. I think 15 of those are mine. And so it's by far the lion's share, but we're trying to be very inclusive. And we like you to look at that report and try and get behind as many of those 70 as you can. And we put together a beautiful binder, which we released at a press conference a few weeks ago. And Amanda on my staff, or whoever, can get it over to you if you don't have it. So the second piece is the Family Support Services Act. As I said, it grew out of what I did with my nephew and all those problems, realizing it's the family that's got to try and pick up these pieces. It's not just the individual that's impacted, it's all of us. So I work with Dan Muser, again, another business person, Republican, Pennsylvania, wonderful, wonderful legislator, but you should get on your radar to work with and tell him I sent you over, recommended. He loves bipartisan stuff. And, you know, he runs a family business in Scranton with his brother, and they're, you know, they're all in on these issues. So that legislation has passed the House already. And we've got Gillibrand and Capito in the Senate. And, we're working to get that over to the Senate now to get it passed over there, and we'll be off and running. Then the other thing I want just to quickly tout is our Commission on Combating Synthetic Opioids. I'm co-chairman of that with Tom Cotton, and we've got two Republicans in the House, one Republican in the House, one Democrat, Senator Markey and Senator Cotton, 4 outside experts, former heads of DEA, 4-star admiral, lost a son, etc., heavy hitters, then all 7 executive branch agencies, Treasury, State, ONDCP, DEA, Defense, and a big budget. And we've hired RAND, and they're working with us to put together a report. And we're not just looking at supply, that's supply issues coming out of China and Mexico. And we're actually going to Mexico on Sunday. So I'm taking a whole team of 15 to 20 people to Mexico Sunday. We'll be in Mexico City. We'll meet with all of the leadership of the Mexican government, military, Navy, blah, blah. Then we're meeting all the US group. We'll be in the Mexican port, visiting the port where the fentanyl precursors come in to learn about port security, technology we can use, scalable technologies. And then we're also going to be in the border in El Paso to look at the southwest border next week. So we've got a big week, all focused on addiction. But part of our report from RAND will be very much focused on demand. So you guys have thoughts and ideas on demand reduction, harm reduction, you name it. Make sure it's all got to Amanda. And this preliminary report will be out in a couple of weeks, a draft, and the final is due February 1. So there's lots of time to get input in it. Lots of time. So if you have things you think should be in our report, get that out to us and we can make sure they're included. But again, we're counting on you and others for ideas. So this commission is all of government effort. And then we're going to work with the White House to try and get something moving early in the first quarter on an all of government effort at a very public level, talking about all the initiatives that we've got rolling in our bills, the commission, the task force, etc. But 93,000 deaths, it's not acceptable. We're better than that. So that's it. We love working together, ideas. We got our disposed opioid bill signed by the president the other day to help get rid of opioids that are unused. We've got good work on housing coming in. I've got all kinds of stuff on incarceration, on treating this like a disease, not like a crime. We got a lot of stuff out there. Hit me with some questions.
Great. Any of our participants, if you have questions, please put them in the chat and we will make sure we get to as many as we can during our Q&A with Congressman Trone. We have one question from Karen about if there is a role for private insurance plans and working with public health departments in both rural and urban areas to better sort of cover workers and families for mental health as well as substance use treatment options.
I got a lot of parity problems where obviously, as we all know, the mental health's not being covered as well as it should be. A lot of different insurance and Medicaid type issues on mental health is treated different than physical health. But the real point she's getting, I think, is rural. I mean, if you're in a rural area, you can't find a doctor or a psychiatrist, psychologist, therapist, counselor that's going to take your insurance. They just don't want to take your insurance. They want paid cash because they're the leader in the market. There aren't enough providers. Last September, it's been a year now, I commissioned a GAO study because I realized this is a national problem. We are getting feedback from GAO now. We're looking at the whole United States. How many psychologists, psychiatrists, therapists, addiction specialists, et cetera, do we have? How many are pipelined? How many go out of the pipeline as they retire? And what do we think we need with this mental health crisis of depression, anxiety that's really been exacerbated by COVID, the loneliness, the isolation, the technology over-reliance that our children have had, et cetera. We've got some bills on children and colleges and things like that also in this area. So we think we need to change the supply side. We need to supply more. That's really the answer. then some folks will take your insurance because they can't just get paid cash every day. So we need incentives to get people into these fields. The pay is low, the work is hard, and they'd rather play golf than be an anesthesiologist and work 3 days a week. So we're gonna need reasons for them to do this good work. And it's gonna have to be credits, whether it's college tuition credits, incentives for work in rural areas. But first, I wanna get the facts, the evidence base. We all know it's there. I represent 3 totally rural counties, and you can't find anybody there to take your insurance. Why should they? They get paid full dollar on the spot when you show up. So it's a problem.
Really grateful that you're tackling the workforce issue. You're right, we're hearing that from every corner of the country as well. When you have your report done and recommendations, we'd love to coordinate with you on getting that out to the community and anything that we can do to support your legislative efforts to address that. It is a huge issue. And you're right, it's the compensation is so much lower in our category. There's also some arbitrary challenges and barriers, red tape that I think we could use your help eliminating. And then there's also just sharing with you some of the amazing physicians and what we can learn from the places that have done a great job of expanding workforce, another area we could probably assist.
Well, we'd love to get your input. I love ideas, and we really beg for that so that I can be put to work and try and do what I wasted spending my time here doing versus wasting my time on some of the bullshit that's here.
Yeah. We have a couple questions coming in, but I just one comment for you, Congressman Trone, to have a member of Congress where your top priority is this issue. It is so meaningful to us as a community, as a patient advocacy organization and a network of families. We don't have enough proper thank yous right now to let you know how important your leadership is to us, and that we notice. We see all the work that you're doing, and anything that we can do to partner with you to advance your mission, we are on board.
Thank you very much for that.
Kenneth Axon, Kenneth Kuntz writes in, does any of your legislation provide more support for outreach workers to assist homeless people suffering with addiction, mental health, and how they can better access long-term treatment?
Yeah, we're beginning to look at this homelessness issue, and I've put together a survey and a study of where we have the homelessness in the United States, you know, what states that's in. It's predominantly 5 states in the West. It's Washington, it's California, it's Hawaii, believe it or not. It's also New Mexico, tied to the Indian reservation. So we're trying to line up where it is, how that then ties into housing prices and some of those issues. And then we're trying to explore those tremendous overlays with homelessness, addiction, homelessness, mental health, homelessness, no job, etc. And I was just up in Baltimore last week with the Secretary Becerra of HHS, and we spent a half a day in Baltimore at the premier homeless shelter up there, and all the things they're working to do on wraparound services that we need for the homeless. So we don't have a lot put together here yet, but we are very, very, very focused now on this homelessness issue. It's pushed me over the edge. It drives my wife insane, and we can't be better than this. And it's just really disappointing. I travel a lot in my business. I have stores all over San Francisco, LA, Seattle. So I see this, you know, my former life is I looked at real estate in all these cities, which I know inside out. And the real estate is really disappointing and depressing how we've treated this area. And so it wraps right into my focus on addiction and mental health. So it's something we really want to spend time on. Love to have ideas on that. But housing's the first, you know, piece, obviously, how we get these folks into housing of some sort. But we got to go meet them where they are. If we don't go meet them where they are, bring medical help to them, go right up to the tent, be there in the tent, talk about getting them healthy, build a connection and a rapport, and then eventually there's been some success. There's a really good group in Miami that I was on a call with the other day with Rosa DeLaura and my appropriations partner, and they've really done some great work there. We're getting them to come up and see us and try and see, someone's built some good mousetraps. Miami's done a job on this, and I want to see how many ideas I can steal from them. And I'd suggest that's something you guys should look at also.
We're actually working with Judge Leifman on some ideas on how to better serve high utilizers of emergency services and other behavioral health services. So we'll get back to you when we have some takeaways. I agree that the Miami model is something we can all learn from.
Yep.
This isn't a question, but just one comment that Congressman Trone has a new fan in me. We need more people like him. So we're getting lots of little love notes for you and all the work that you're doing in our chat and our Q&A here. So your work is very, very, very much appreciated at APF. If you have another moment, in terms of other issues or priorities to flag, the increase in stimulant use disorder is both methamphetamine and crack cocaine, crystal meth, really making sure that we prioritize. Sometimes in the patient population, those that are struggling with stimulants can feel a little less than, like it's okay to have an alcohol use disorder or an opioid use disorder, but we can feel that there's more stigma attached with stimulants. APF has a few ideas, both on how we can incentivize the use of contingency management, which is evidence-based, and a treatment for methamphetamine and cocaine use disorder, and some other barriers that exist that could really sort of ease the way for better treatments for stimulant use disorder. But is this something that your caucus is working on? Or are there any measures that we can be supportive on that are in that lane?
Yeah, that's a good one. That's a good catch. It's not something that we've had discussions on, but we should absolutely look at the stimulant side. Absolutely, for sure. I mean, some of these stimulants are so addictive. I've seen that live in a huge way, and some issues in my family. And I know exactly what that can do. And I'd be delighted to take a look at that and get involved in those areas for sure. It's just a different form of addiction, and we would love to do that.
Wonderful. We'll reach out. Yeah, we love working with your staff as well. So we'll be in touch right away and get all the feedback that we have from our network. We'll make sure that we're passing that along with some of our legislative ideas.
Great. Yeah, we've got a great staff. I've got a full complement of 18 people, which is the most anybody can have. We figured out how to afford everybody and have great, good pay, good benefits. So I can get the best staff. And I've got 4 full-time fellows also, all working for me on other people's payroll. So we're more staff heavy than anybody unless you have a committee. So we've got the horsepower, and all we do is policy. We're not wasting our time on MSNBC and our opinion about X, Y, and Z. We're here for addiction, mental health, criminal justice. Bingo.
That's amazing, Congressman Trone. We have another comment that's come in from one of our attendees about will there ever be a potential for federal funding to universities for scholarships and student loan forgiveness to incentivize students to work in the field of SUD and mental health disorders?
100%. That's what's got to have to happen. That's got to be part and parcel of how we're going to get folks into these areas. For sure. Money talks. And we got to be honest about it. And they're there for the love of the work. You're there for the love of the work and your humanity. And that's why they're there, but they got to pay their bills, and we got to do better. It's like we treat our teachers, we don't pay them enough like we should. Things that are about our children, that's where you ought to spend our money, and we can do a few less F-35s.
Yeah, that's so true. We need to have the workforce and the expertise to respond to this epidemic. It's sort of well beyond crisis point. One of the two of the other items that our network has shared recently are there are some barriers on not being able to use federal funding to employ, let's say, peer recovery coaches or recovery support specialists until they've been either out of treatment for a two-year mark or out of incarceration. And when you have folks who are trained to be deployed to the workforce more quickly, the question is if some of these arbitrary lengths of time before you can use your grant money to hire folks is really helpful. So there might be some ways that we also connect you with the peer recovery support community to make sure that we're, we have the pipeline of all of the different professions that we need to have on the ground to treat addiction and support recovery.
Right. No, I completely agree. Peer recovery is just crucial. I have a family member, in recovery for 8 years. She's doing very well, but AA and peer recovery are so important, in her ongoing success. And so, I'd love to, you see some specific obstacles, we can slide those into an appropriations bill or wherever we need to get the language fixed. So we can eliminate some of those. Those are easy ones that we can, once we know about it, we can figure out. You tell us if you know how to fix it and we'll do it.
Wonderful.
But there's often so many limiting areas that's craziness.
Yeah, no, it's true. And we need to hearing directly from like a feedback loop from the field, patients, families, and those on the ground. We can help get you quick feedback and rapid feedback so that we are tackling those in partnership with you quickly.
Good, and get as much as you can over as soon as you can. We're going to make the big push at ENC to take a big chunk of time, after the first of the year when this other, has arise behind us, and we'll move forward, on a big package of addiction, mental health with Frank and get things cranking at once. And so we want to get all the right stuff in there because we'll move a package is how we're going to do it.
Wonderful. We're going to get you a bunch of stuff next week so we can keep it moving.
I'll be in Mexico with Amanda, but the other folks will be here.
All right. Well, you'll have some emails waiting for you when you go back from your important trip into Mexico.
Great. I love assignments and I love projects. So, bring it on. That's why I get up every day.
No, well, we're so grateful to you for your leadership and all that you're doing. We'll keep connected with your staff so we can share all of your priority areas and movement in Congress in the addiction space with our whole network. And we're getting you a very large sign-on letter for at least 2 of your bills next week. So stay tuned for that too.
Thank you very much. And the last thing I'd mention is Senate Republicans. Anybody seeing family connectivity, staff connectivity on their staffs with our issues. That's how we can get somebody motivated, that personal connectivity. We've done a lot of our research off the record, but if you see opportunities, you see ideas where there's a reason we can talk to somebody that they'd be motivated by their own team, if not their own family. That's how we're going to get more supporters. And that's what I need, Senate Republicans.
All right, we will work on that. We have a pretty amazing network of individuals impacted who are happy to share our stories and our own experiences personally. And we're a little light in Wyoming, but outside of that, we've got 49 of the 50 states very well covered.
Okay, I'm a little light in Wyoming too.
Well, I'm just so grateful that you've spent so much time for us. If there's any other questions from our team for Congressman Trone, Carol Boyer has put a question in. Do you know why here in Maryland, the 5.4% one-time increase for SUD services through Medicaid doesn't cover residential care?
Not a clue. Absolutely not a clue. Amanda, see if you can figure that out. My team, Ron, and get back to him on that one because that's above my pay grade.
Well, anything we can do to support information about why residential care can be very helpful, particularly for specific times of SUD. You let us know. I have another question. I mentioned we just have more nice notes in here that keep up the great work, and we very much appreciate you.
Okay, great. Well, thank you for your time, and most of all, thank you for the work you guys do. It's tough work. We really appreciate it. It's moving society in a good direction and type of things you ought to be doing down here versus all the other BS. So thank you.
All right. Thank you so much. We really appreciate you taking the time to be with us today.
Happy to do so. Take care. Bye-bye.
Bye-bye.